Good morning, friends. Welcome back to my YouTube channel, Medical Classes by Dr. Srinidhi Kumar Acharya. Since last few classes, we are discussing about cardiovascular problems in children, and in continuation of the same, today we will have another topic. So that is again cyanotic heart disorders. In the last class, so we have discussed some of the basic parts, like how to differentiate between the breath holding spell and the central cyanosis of the cardiac disorders, how to differentiate from the respiratory problems leading to cyanosis, etc. And today we will again go for the clinical aspects of cyanotic heart disorders. Now, why there is cyanosis in case of cardiovascular problems? Cyanosis in case of cardiovascular problems because of congenital cardiac problems, maybe because of two possibilities. Number one is cyanosis is there with the increased pulmonary blood flow, and cyanosis is there with the decreased pulmonary blood flow. Now, cyanosis with decreased pulmonary blood flow. Now, there are certain conditions where cyanotic heart disorder is there, cyanosis is also there, it should be there, and the cause is decreased blood flow. Okay, so that means if there is any structural lesion in the right side of the heart, for example, pulmonary stenosis, for example, some infundibular stenosis or atresia of the pulmonary trunk, okay, like that, if there are some structural problems related to the right side of the heart is there, then there may be decreased blood flow to the lung area and purification of the blood will not take place. Definitely child will develop the cyanosis. How to differentiate this? A cyanosis is there, and we should say that congenital, in the beginning the congenital cardiac problem is there, in that also cyanotic cardiac problem is there, congenital cardiac problem is there, in that also that cyanotic cardiac problem is because of decreased blood flow. The most common thing is in such condition there is no recurrent respiratory tract infection. We know that why recurrent respiratory tract infections are there in cardiac problem, because of the collection of the blood in the pulmonary area, pulmonary parenchymal area. Congestion of the blood is there. Because of congestion, compliance decreases. Because of congestion, there is a stasis of the blood which acts as a culture media for the growth of the organism, and because of this the clearance of the lung is very difficult, and that all favors the infection, especially in the lower respiratory tract. But here, as the blood circulation to the lung itself is less because of the obstruction, the chance of recurrent respiratory tract infection is less likely, and there is no pulmonary edema, but still he gets cyanosis. This is one of the basic things clinically we have to understand. If the child is having cyanosis and having cardiac problems, but child is not having recurrent respiratory tract infection, immediately we have to think that yes, this may be because of a decreased pulmonary flow, because pulmonary area is not receiving excess amount of the blood. Now, there are two reasons for that. Okay, so why the pulmonary blood flow is decreased? Two reasons are there. Already I have explained. There is some kind of obstruction is there, okay, to the right ventricle, or there may be right to left shunt is there. Now, two possibilities are there. Why the blood is not going into the pulmonary area. One is the pulmonary trunk is get constricted, or pulmonary walls are get constricted, atresias or stenosis, etc. One possibility, blood will not go. Second possibility is from the right ventricle, blood is directly going into the left ventricle. This is called as reversal of the shunt. In case of reversal of the shunt, blood from the right ventricle is, most of the blood is going to the left ventricle only. Okay, now what happens? Less blood is there present in the right ventricle, so definitely less blood will be pushed into the pulmonary area, pulmonary trunk. So these are the two possibilities. Now, when there is decreased blood flow to the pulmonary area, definitely there will be cyanosis. Now, again, we will have two classifications. One is cyanosis. We are talking about congenital cardiac problems. We are talking about cyanotic cardiac problems. We are talking about cyanotic cardiac problem with a decreased blood flow to the lung. In that also, we have got two possibilities. One is cyanosis coming early and cyanosis coming late. Now, understanding this is very important. Okay, cyanosis coming early means child develops cyanosis in the very early part of the life, maybe within 10 or 15 days, or maybe within 2 or 3 days. Cyanosis coming late means it just takes some time, months together, or after 1 year child start with the cyanosis. Now, first we'll discuss about cyanosis coming late. In this condition, there will be decreased pulmonary flow and cyanosis appears very late. There may be constriction of the infundibulum. which is under the sympathetic nerve control. Now, infundibulum is one area which is actually present in the right heart. That means where the pulmonary trunk actually starts. Okay. Now, actually, that particular area is made up of so many muscles and all, and it is under the control of sympathetic nerves. It is under the control of sympathetic nerve. As we know, when there is a fear, when there is a cry, when there is a exercise, stress, etc., it always leads to sympathetic stimulation, and there is increased activity of the sympathetic system. We know that. But actually, what happens is this particular infundibular area in children, although it is under the sympathetic control, okay, that means whenever sympathetic activity increases, so there is a constriction of these muscles. Whenever there is a constriction, there is a blockage for the flow of the blood, and cyanosis should develop. But in children, it will not develop, because in children, the sympathetic nerve system is not well developed as in case of adults, especially at the time of the birth. So although there is a potential cause for the development of the cyanosis, sometimes that cyanosis may appear late after the complete maturation of the sympathetic nerve system in children. And this is one of the main condition where, although there is a potential cause for the development of the cyanosis in congenital cardiac problems, cyanosis appears late. Okay, this is one condition. Now let us discuss about cyanosis appearing early. What is the cause for the early development of the cyanosis? This do occur in case of admixture pathologies. Admixture means when pure and impure blood are mixed together at the ventricular level. It's called as admixtures. Okay, this is commonly is in shunting. It may be VSD, or it may be PDA. Okay, it may be PDA. To some extent, it may be in ESD. So why early cyanosis will appear? In this condition, the deoxygenated blood enters into the oxygenated blood chamber. Okay, from the right side, deoxygenated blood is there. On the left side, oxygenated blood is there. Now, somewhere there is a shunt in between, because of which the two pure and impure bloods are get mixed together. So this is possible admixture pathology as it occurs in pulmonary anomalous venous return. Sometimes this also occurs in the pulmonary area, pulmonary veins, which carries a pure blood from the heart. They has to get open into left atrium. From there it comes to the left ventricle. But sometimes these veins, because of the structural problems, so they may again get open into right ventricle only, or right atrium only. So this is called as pulmonary anomalous venous return. So this may lead to cyanosis, and it appears very early. Similarly, pulmonary veins directly opens into right ventricular or atrium. Sometimes pulmonary vein carrying the pure blood may directly opens into right ventricle, or sometimes to the right atrium. Okay, so there will be hyperdynamic circulation, and this leads to CCF along with the cyanosis, which develops very early. So such times early. So similarly, if there is a transposition of the great vessels from the right ventricle, actually pulmonary trunk has to begin. From the left ventricle, actually aorta should begin. But opposite is happening. From the right ventricle, aorta is opening, and from the left ventricle, pulmonary trunk is opening. So this is called as a transposition of the greater vessels. So this also leads to the cyanosis, because pure blood is again going back to lung, and impure blood is again going back to the body. Again, there is no proper verification, and oxygen pressure fall. So these are the conditions where cyanosis develops at the early step. So now, if the child develops early diagnosis, what are the possibilities you can infer? If the child develops late cyanosis, what are the possibilities you can infer? Now, this is very important to differentiate between the cardiac and pulmonary cyanosis. Cyanosis developing because of the cardiac cause, and cyanosis developing because of the pulmonary cause. How we will go into differentiate? Talking about the respiration, in case of cardiac cyanosis, child is comfortable, actually relatively comfortable at rest. In exercise, he may have some problem. Otherwise, he is maybe child mildly tachypneic. Otherwise, he is comfortable at rest. Whereas pulmonary cyanosis, the child is not having comfortable life, so he is having tachypnea, distress, and retractions, etc. Now, crying or any other efforts. In case of cardiac cyanosis, the cyanosis worsens, whereas in case of pulmonary cyanosis improves, because crying improves the respiration. Okay, so while baby is crying, the respiration is increased, so more oxygen will be taken inside, so cyanosis improves. It's just like oxygen therapy. Auscultation in case of cardiac cyanosis definitely will get the cardiac murmurs, whereas in pulmonary cyanosis there is no murmurs, rather there may be sometimes rails, crackles, these wheeze sounds, etc. may be there. Then cardiac chelote in X-ray, chelotes. So abnormal shape and cardiomegaly will be seen, egg shape and all these things, figure 8 shape, egg shape, etc. Now, whereas in case of pulmonary cyanosis, most of the time the chest X-ray looks normal and obliterated. Cardiac margins may be little obliterated. ECG is abnormal in case of cardiac problems. ECG will be normal in case of pulmonary problems. Partial pressure of the CO2, PCO2, that is normal or low, and in pulmonary cyanosis it is usually increased because problem is there with the expiration. Then response to 100% O2, yes, cardiac cyanosis there is no much improvement, whereas pulmonary cyanosis definitely there is improvement. So these are some of the important things, how we differentiate between these two things. Now there are some other type of cyanosis which is called as differential cyanosis. Differential cyanosis means when the blood supply to the lower or upper part of the body is restricted due to various causes. Okay, upper part of the body is receiving good amount of the blood supply, lower amount part of the body is receiving no blood supply or less blood supply. Then what happens is cyanosis develops in the lower part and there is no cyanosis in the upper part. Now this is possible. This is possible in some of the cardiac problems. For example, upper part, preductal stenosis, duct is there, infundibulum, aorta, infundibular part is there, duct. If the preductal stenosis etc. is there, and upper parts will be pinkish, and postductal problems, the lower part will be cyanosed. The causes are severe coarctation of the aorta, one of the causes. Lower part is not receiving the blood, upper part is receiving the blood. Okay, aortic arch interruption or severe pulmonary hypertension. So these are some of the possibilities, differential cyanosis. Another is reverse differential cyanosis. Transposition of the great vessels with the coarctation of the aorta or aortic arch interruption. Upper body is supplied by the systemic venous blood. Lower part is supplied by the oxygenated pulmonary venous blood. So this may lead to reverse differential diagnosis, exactly opposite to differential cyanosis. Differential cyanosis, upper part is normal, lower part is cyanosed. Whereas in reverse differential cyanosis, lower part is supplied by the oxygenated blood, whereas upper part is supplied by the systemic venous blood. Upper part have cyanosis and lower part is normal. Now let us discuss about the complication of cyanotic heart disease. This part we will take in the next class. Thank you very much for being with me. Don't forget to subscribe my channel and also please give your valuable